Good morning, I am Dr. Ashish Sabharwal, urologist, andrologist and robotic prostate surgeon. I am director of Blue Ribbon Prostate Clinic, New Delhi. Today I will tell you how the penile implant works. There are two companies of penile implant available, the AMS and the Titan Coloplast. I use both the implants. There are two categories of implants in both the companies. One is the malleable implant. Malleable implant is a silicone rod. One silicone rod is inserted into each of the corpora, so in all there are two silicone rods inserted inside the penis. This is the penile implant, which is a malleable rod. The whole of it has a graduation of 25 centimeters. Whenever we do the surgery, we measure the corporal length with help of measurement device, and based on that we cut the implant to the desired size. Once the implant is cut to the desired size, it is inserted into the corpora and it is fitted inside the body. And you see, when you bend it, it can go down, and when you make it straight, it will go straight. It has very good quality material which can get totally down, and it is totally concealable. This is the malleable implant. It has got only one piece, that is the penile implant. The other is a three-piece implant, that is an inflatable penile prosthesis. The advantage of that is that it gives a more natural erection, because like you see in the malleable implant, although it is bent, but it stays straight. But the three-piece implant, it becomes smaller, just like a normal penis when it is non-erect. And it has got three parts. One, the corporal cylinders, and then the scrotal pump, and then a retropubic reservoir. So whenever we need an erection, the scrotal pump is pressed, and that brings water from the reservoir into the pump and then into the implant to inflate it, and it becomes a normal erect penis. Malleable and the three-piece have advantages and disadvantages. The advantage of the malleable one is, number one, it is easier to place, lesser side effects, lesser chances of infection. The disadvantage of the malleable implant is that the implant stays, although it is bent, but the penis stays stretched. So some people don't like the idea of having the penis stretched all the time, although the people who have it don't find it uncomfortable. The malleable implant is safer in diabetic patients and people who don't have very good manual dexterity. So this is very easy to use. The three-piece implant, the disadvantages are it's a more high-tech equipment. It needs more effort during surgery, and the cost is higher. The cost of the three-piece implant is almost 3 times higher than the malleable implant. The advantage is that when you deflate the implant, penis becomes totally small and like a normal size. And when you inflate it, the penis becomes erect, just like normal erection. There are many people who, in spite of the cost of the implant, they prefer the three-piece implant because of the advantage of having a more natural erection. So, in short, depending on patient to patient, somebody would be better suited for a malleable implant, somebody would be better suited for a three-piece implant. Malleable cannot be given to all patients, three-piece cannot be offered to all patients. So, you should consult your doctor to see which is the best implant for you. Thank you.